Hey guys, this is Dr. Hill from Rayford Animal Wellness Clinic, or ROC, where pets aren't just cool, they rock. Hey, thanks for joining. Super excited. This is something I've been wanting to talk about, and I see it all the time. Arthritis. So if you don't know, I love older kiddos. So I've got an older dog, Dottie, and then an older cat, Dexter, and I have dealt with arthritis with both of them, which is not surprising. I read some numbers, and one of them said about 25% of patients are going to have arthritis or be diagnosed with it in their lifetime. This was dogs. Sorry, we assume cats in their lifetime, it's probably much higher. In some research, 90% of cats had evidence of arthritis after the age of 12. So I thought that was crazy. If you have a cat over 12, it probably has arthritis, like 90%. That's crazy high. With our dogs, it can be high too. And in that research that I was talking about, she said 60% had evidence of it. So I think what she was saying is we do diagnose it in 25%, but 60% have signs or have evidence on x-ray. So it's probably much higher than that is my thought, especially as a veterinarian and seeing a lot of older patients. Every once in a while I have an older kiddo and I mean, they are bouncing and it's like, never mind. But remember, animals don't show signs like people do. They are not wusses. So my kiddo Dottie, she does jump up. Now she has obvious arthritis, like you can see in her walk and you can feel it in her knee. So I know it's there, but that girl, she's going. So some of these guys, even with it, are just gonna keep on trucking, but I do know it bothers her and I put her on pain meds for it. So what is arthritis? Arthritis is a roughening of the joint. Usually due to kind of aging, it can just happen due to aging. We've got the joint is where the two bones come together and they're moving end on end where that joint is. And we have some fluid there to try to make that movement fluid. And we have the cartilage, that should be nice and smooth and make that bone-on-bone contact really frictionless and make them move easily. So with arthritis, we get thinning of that cartilage to maybe even sometimes it's gone, and you're really looking at bone-on-bone contact, and it causes some roughening of those bones. So now it's like grinding, right? Now we're grinding as we try to move, and that can obviously be painful. So if you're starting to see that, or if the animal's dealing with that, there are things that we can usually see, and you see it before I see it. And I really listen to what you tell me when you come into the clinic to try to determine, is your pet dealing with some arthritis? And it's surprising to me when I ask people questions, because I think, yeah, that's arthritis. And to them, it was such a slow, and this happened to me, it was such a slow progression that you kind of just think it's an aging change. No, they're just getting older. Age is not a disease and doesn't, they don't usually slow down just because they're getting older. It usually means their arthritis is bothering them, so they're slowing down and it's progressing. So you're seeing it a little more and more. And that happened to me with my dog, Bear, who's now passed. But I noticed he wasn't meeting me at the door as quickly, and I thought he was just getting older. I tried pain meds. I did a pain med trial, and we'll talk about that. And all of a sudden, put him on some pain meds, he's meeting me at the door like, let's go, lady, and back to his old self. And I realized I'd been preaching to people to try that multiple times, and I'd never tried it with my own dog and realized he was dealing with some pain. So that is, something for you to think about if you start to see some evidence, and the things I want you watching for. In your dogs, the big one is slow to get up. If I see a dog that's slow to rise from sitting, arthritis. And people will tell me, oh, they didn't cry. They don't cry. Again, they're not wusses. They are just going to deal with it. And that slowness to get up is a huge indicator almost every time. Not wanting to go upstairs. Oh my gosh. Yeah, dogs, that shouldn't bother them. So we know we're dealing with some arthritis if you're seeing that go on. And just stiffness, if they're moving stiffly, especially right when getting up, right? And they sometimes work out of it. Or if they overdo it and then they're painful after getting too much exercise, playing with a friend or whatever. With cats, it's a little different. So cats are sneaky, and cats may just not be as affectionate, not be out as much, not jumping and moving around. Decrease in grooming is one as well. So they're not grooming because they can't get back there. They're uncomfortable or having difficulty getting a position in the litter box. What a bummer, right? Like I got to go to the bathroom, but it hurts. So if you see problems in those areas with cats, that is huge. Please let me know because cats hide it way better. They are just like, no, I'm not going to show you these signs. But we can really make them feel better with some simple changes. So what can we do about it? There are actually a lot of things, but I'm going to break it up into 5 categories, okay? We're going to talk about medications, supplements, weight loss, exercise, and then kind of alternative therapies. I'm going to include rehabilitation in there, right? So medications I went with first just because I'm a veterinarian, right? And that's what I do. Medications, I like it because we can give improvement. We can cause them to feel better quickly. I love supplements, the other things I talked about, but those take time. So most veterinarians are going to grab your medications, and usually it's going to be a non-steroidal anti-inflammatory. That is the mainstay because it does help quickly and they feel better quickly, right? And that's what I want, because if I can get them moving better for you, we have a better chance of that weight loss. We stop the cycle of them just sitting around and getting stove up and not wanting to move. So to me, it just makes sense. Like, let's get them less painful. Let's try these medications. Non-steroidal anti-inflammatories can have some side effects, so we want to be careful. We may need to do some lab work. There are some safer ones out, so so we'll talk about that. What are the positives, the negatives? What are we looking at? What do we want to do with this? I have people say, well, I don't want them to be on meds their whole life. Does that mean you don't want them to be comfortable their whole life? Because that's my plan. I'm not trying to get side effects. We're not trying to do those things. And we want to use meds as little as possible, but we want them comfortable as well. And I hope as I get older, my doctor's not like, well, I don't want you to be too comfortable. Let's do it, but let's try to get them off the meds. Don't get me wrong. And we're going to talk about some supplements that I think might help. I'm even game. So medication wise, non-steroidals, I have some other pain meds that I sometimes use with those non-steroidals to get them comfortable, but I'm also going to at the same time start some supplements. And when you talk about the supplements, you tend to think about glucosamine chondroitin. That's one of the mainstays. And yes, let's do it. But there's some new ones out as well. We know that now fish oils can make a big difference. They're anti-inflammatory. There's green-lipped mussel. There's all kinds of new things kind of coming out all the time. And don't think of it like I have to pick the right supplement right now that has to be the right one. We might switch. We might try one and see how things go, and then switch, or we might try more than one. With arthritis, this is a multimodal approach. We have to find that's why I mentioned the 5 things. One is probably not going to do it, or it is going to do it, but arthritis is going to progress. We know that we cannot necessarily stop it. We want to try to slow it down though, and we can't reverse it. Okay, unfortunately, but let's use these meds and supplements and things like that to make these guys comfortable and help slow this disease down. So supplements, the last collagen is another one. I think that's interesting kind of coming out. CBD though, let me throw my plug in for that because I saw a kiddo that we had to take off the non-steroidals because of other diseases. He was having side effects with the meds, and his dad put him on CBD. I just happened to come walking up. I was like, whoa, Joe's walking pretty good. And he said, yeah, I put him on the CBD that my friend, has a company of, and he was doing great. So try CBD. Why not? It's pretty safe. I have had some people really against it. That's fine too. I have other great supplements. We can go over these things and figure out what you're comfortable with and then try them to see what your kiddo does best on. But CBD is out there. It seems to be pretty safe in the research that's been done so far. And it's a trial. Like, try it and see how they do. Watch for potency, watch for safety. There are different companies that have, that are doing things to monitor for that. And so, look into those things and pick a good supplement that is safe. And I do have, in a different talk, I do have references for that and some ideas of where you can get safe supplements. So, so pretty exciting actually as an option. Okay, weight loss, huge. So we know the bigger they are, the more arthritis is going to affect them, the more likely they are to have it. So let's really work on it. Let's make that a priority and try to work on getting your kiddos' weight down. Food becomes the way, because we have to be a little careful with exercise. I want them exercising, but I don't want them overdoing it on their joints. But if we can get them to lose weight, they tend to be more comfortable. They're going to move around more. They're going to feel better. It is a great cycle. That's the good cycle that we want to get into. So food is huge. And I have some diets with glucosamine, huge amounts of glucosamine chondroitin and fish oils in them, made for weight loss. And I'm super excited to try to help with that. And some people do wonder about different types of food and how nutrients can affect joints. I'm fine with you trying different foods as long as make sure they're evaluated by a veterinary nutritionalist, okay? Some of these diets are not, and no matter what you try, I want it evaluated by a veterinary nutritionalist to make sure it's healthy for your pet. As long as you've got that, try it and consider it a trial. 2 months. Let's see what happens. Let's see how your kiddo does. But I do have some prescriptions that I feel good about that have proven in research to be helpful, and my own kiddos are on them, just so you know. So we have options. It's awesome. Awesome. So exercise. Exercise, the goal of exercise is to get them moving, get that stiffness out of the way, but not to overdo it. So that is going to depend on your kiddo and their comfort level and how far they can go. But at least 5 to 10 minute walks and multiple times a day is better than just trying to really get, a mile or 10, whatever you do, but out of the way, right? Like all at once. So multiple times gets those joints moving multiple times during the day, and that can be super helpful. And we can go over other recommendations, but start with that. Get them moving a little bit. Alternative therapies are awesome. They can be pretty costly, and that can be tough, but a simple one is cold and heat therapy. So just like we might put a cold pack on to try to decrease inflammation or use some warmth to try to get moving, be careful, don't overheat, don't burn your kiddos, and don't put the cold directly on, use your towels and, be reasonable, right? And so we can go over that. But those things can help give comfort, and then they move more and, cycle. So yeah, super simple, not as expensive. Now we'll go to some more expensive. So rehab, we have a great rehab facility here in the Woodlands Spring Woodlands area. Awesome place. I've taken my dog there. Bear, he had degenerative myelopathy and he couldn't use his back legs, and they helped to strengthen him, and he did great. They have underwater treadmills and just all kinds of things, and they measure his muscles to see how he's doing and range of motion and all this really cool stuff. Pretty expensive though, totally worth it for him. It bought me time with him. And some of these things can work for arthritis, just general arthritis as well. And so yeah, some cool stuff, some cool options, and even meeting with them to see if there are things you can do at home to help your kiddo is a great idea. So I think that's, something that we maybe don't explore as much and can be super helpful. So, okay, laser therapy. At this rehab facility, they have laser therapy, E-stim, shockwave, acupuncture. That's a great one as well. And sometimes you could have acupuncturists come to your house and, things like that. So that can be something that some kiddos really respond well to and is really helpful. And think about it. We have things. We even have stem cell therapy. So that's obviously a more expensive option. And I do know the rehab facility has that. But there are some animals that really respond to that. So that can be great if that's something, that you want to think about. Platelet-rich plasma as well. So these are some alternative therapies that have proven to help in some cases. And so I think something to think about, especially if you have a kiddo that's really not responding to the normal things that I have for them, where you're just like, this isn't working, but I want to take more steps. Let's take those steps. Let's do it. So that's what I've got. I hope it was a little bit of information, I hope, and just helps get you start thinking of what are the things I can do for my kiddo if I start to see evidence of arthritis, and start the conversation, of course, and keep these guys comfortable as long as possible. That's my goal. So, all right. Thank you guys so much for visiting, and I hope you have a great day. Hope to see you soon. Thanks for rocking.